Hi, my name is Nicole, and this is my presentation on alarm fatigue and the effects it has on patients and staff, and what can be done to make alarms a priority and to help minimize the alarm fatigue healthcare workers are facing every day. Alarm fatigue occurs when a staff member is exposed to a large number of alarms, causing sensory overload leading to slow or non-existent response to alarms. Nurses and healthcare providers can easily become desensitized by alarms constantly going off and can cause them to not take alarms serious, potentially having a severe impact on patient safety. Hospital-wide, there are numerous alarms sounding off every minute of every hour, 24 hours a day. Alarms ranging from oxygen sensors, IV pumps with medication, telemetry cardiac monitors, ventilation machines, and much more. All alarms are so important and need to be addressed. But many attribute the constant false or nuisance alarms to a crying wolf, and they are not taken seriously. But this is how patient safety is compromised, and the need for identifying how to fix the problem is so important. But how do we fix the problem of nurses getting desensitized and burnt out of constantly turning these alarms off? The Joint Commission said that 85 to 90% of the alarms are false or nuisance alarms, indicating conditions that don't require clinical intervention. Identifying the problem source of alarm fatigue is the first step. One of the problems with the alarm systems is that so many of the alarms have similar sounds. It becomes hard to distinguish what alarm is sounding and its importance. For example, an IV pump may be alarming for air in the line or infusion complete, but when the nurse goes to check, the battery pump is low. Or on the telemetry unit, a heart monitor keeps sounding for bradycardia or low heart rate, but this may be the patient's normal heart rate, and the nurse or monitor technician begins to ignore it or becomes annoyed at the constant alarm, and they may not actually see it as alarming for something more serious. There have been many instances where the healthcare worker may turn off the alarm simply because they are tired of hearing it go off, and this results in patient harm or more seriously death. There also becomes no urgency to respond to the alarms, as one nurse may say, it is not their patient's alarm, and they expect someone else to respond to the alarm. This creates a delay in response time, and ultimately, the patient safety is compromised. It should be everybody's responsibility to answer all alarms. The Joint Commission has implemented reduction in harm from alarm systems. In the most recent update from the 2017 National Patient Safety Goals, they recommend having team input and education from departments and healthcare workers of the importance of alarms, what alarms might be unnecessary in contributing to alarm noises, and the potential for patient harm. They recommend establishing policies and procedures for managing the alarms. They recommend clinically appropriate settings for alarm signals, when the alarm signals can be disabled, when alarm parameters can be changed, who in the organization has the authority to set alarm parameters, who has the authority to change the alarm parameters, and who can set the parameters to off. It is especially important to educate nurses on alarms and their meanings and how to properly address them. Another thing that can be done is reducing false positives by making sure leads are applied properly on patients, especially if they're sweaty. This can create a false alarm. If a patient naturally has a low heart rate, it would be beneficial to set the alarm parameters appropriate for that patient. Also, clarifying who is responsible for alarms by implementing policies for staff or nursing with guidelines that alarms are everyone's responsibility. Also, clear handoff communication between departments and nurses will give clear understanding of what should be monitored for the patient. It is important that staff emphasizes the patient has an irregular heart rhythm, low or high heart rate, appropriate oxygen level, and much more. And making sure when patients are transferred between departments, monitors should be properly reapplied in a timely manner and the patient not left without one. With all these interventions, it will help to reduce the alarm fatigue. With the end goal of reducing alarm fatigue, patients remain safe, staff remains diligent in responding to alarms, and staff and patients can be in a safe environment, allowing for optimal healthcare. These are my references. Thank you.